You guys want to hear something absolutely insane? So as a dentist, I had massive success with the procedure that I had little to no experience on, but I was able to start over 50 cases in just 6 months. You can see here, that's the graph showing you the proof, and these are the actual numbers that came from the procedure. And so this equated to over $500,000 in production in just 18 months. And I'm showing this all to show you that even if you have no confidence starting a new procedure, you can absolutely be successful while still keeping your patients safe. And so for those of you who don't know me, I am Dr. Avi Patel, and I'm a dentist, as well as the leading clear aligner educator on social media. I have taught over 180 dentists how to implement aligners into their practice through my education platform, Clear Aligner Advisor. But it wasn't always like this. Before I had any experience teaching dentists how to do aligners or even offering it, I was terrified at the thought of even talking to it about to my patients. And I was always struggling to find the confidence needed to actually select cases and discuss treatment options and then follow through with the treatment. And so I spent hundreds of hours, tried countless strategies, and I found out more ways how to do this the wrong way before I figured out exactly how to get confidence with a brand new procedure that I had never done before. And so I'm going to save you the thousands of hours and the battle scars, and I'm going to tell you the 3 simple steps to take to get the confidence that you need to offer a new procedure, even if you have no idea how to do it. Now, this method can be applied to any new procedure that you're thinking of adding to your practice as a dentist, but for the sake of this video, we're going to just keep it focused on how to do it with the fastest growing procedure in dentistry, which is clear aligners, and it is called the FET method. The FET method consists of 3 components. You need to focus and commit, you need education and mentor, and then you need trial and error. I'm going to break all these down as we go through this training. And just to remind you, this training works for all brands out there, so take it and run with it regardless of what brand you use. Now, have you ever felt so stressed out and overwhelmed by all the things that you need to do in a dental office, so much that you simply have no ability to dedicate the time needed to add anything new to your plate? You're not alone. I can totally relate. So let's rewind some years back where I was a dentist who wanted to provide the highest level of care to my patients and offer expanded procedures like implants and aligners so that I can make more money, have more time, and have a greater impact on my patients. Now, I wanted to implement them as efficiently and as effectively as possible so that I could do a lot of cases over time. But the problem was I had to split my time and focus and energy between learning everything about 2 procedures instead of just 1. And it worked in the beginning, but as more challenges came up with implementation, like trying to train the team, I realized it was too much to do both at the same time. So I decided to make it easier, and I just needed to pick 1 procedure to focus on. And I looked at which one was lighting me up more. And it was coincidentally the one that I was doing more of, which were clear aligners. So from that point on, I was still offering implants, but I truly only focused on improving and implementing with aligners. Now, this made a world of difference for me because I felt like there was less pressure on me to make everything work. And all I needed to focus on was making this 1 new procedure work. From what I call the FET method, this is the focus aspect in full effect so that you can channel all of your energy into one thing versus multiple, right? And so when you commit to the one thing, it ensures that you don't do a disservice to it because it actually limits all the other distractions and the noise that's out there. And then what you'll see is that this ease of communication starts to happen with your team, and it's a byproduct of focus and commitment on your part. Now, there are 2 critical things that you need when trying to implement a new procedure in your practice, either education or a mentor. And if you have both, that's like winning the lottery. I only had 1 of these in the beginning. Well, kinda. So I was certified to do Invisalign because I went to NYU Dental and they put us through a certification course, but it was hot garbage. Ask anyone. We learned nothing when it came to how to actually do aligners. We pretty much learned how to fill out Invisalign's prescription form, and then we got a whole marketing spiel on why it was the best brand out there. And, so when I graduated and I started practicing, I didn't offer the procedure because I knew I didn't have the education to do it. And if you're watching this video, you probably felt the same. And so this put me in a hard spot because I felt like I could never actually live up to my true potential when I was treating my patients due to this lack in skill set. And luckily, I found my mentor, Dr. Christina Blocker. She's amazing, and she guided me through the initial struggles, and she gave great advice on what to do and what not to do when starting out. Now, I remember emailing her all the time, asking her all my questions, and she was so kind to take the time to respond to me. And I'm super grateful for her in my journey. The beauty of aligners though, is nothing is super urgent when compared to other procedures like implants and surgery. Because if you have a question mid-surgery and you're in the patient's mouth, like you can't just get up and call someone because it's surgery. But like with aligners, if I had a question about a case, I could either ask them before or after the appointment, sometimes even during when the patient was in the chair, because there really isn't a severe hands-on component. Now, this experience of having a mentor coach me through the small, unexpected hiccups along the way was invaluable, and it gave me the confidence to offer this procedure to my patients. And so this is where I just want to talk about the power of education and a mentor. Because if you think about it, they're two different things. The education gives you the foundation, and the mentor is your express pass. And you got to have at least one of these. But if you have both, you are going to be successful even faster. Now, before we dive into that, I just want to let you know, I am the founder of Clear Aligner Advisor, and this is our Clear Aligner education platform. And we have helped over 150 dentists integrate aligners into their practice, and they've gone on to generate over $9 million in revenue from aligners alone. We have a bunch of free trainings at our website, clearalineradvisor.co. The link for that is in the description below. And also, if you want to actually dive into a course where you can have the structure and the framework to be successful with aligners, check out our program, Aligner Blueprint. A lot of dentists get a lot of success with it. They usually go on to start like 3 or 5 cases after they do the program. Back to the training. So remember how I got certified to do Invisalign in dental school, but I had no idea how to actually do it? So technically, I was certified and licensed to do the procedure, but it was at my own risk and liability, just like everything else in dentistry. And I wanted to offer this procedure, but I was terrified of starting because there was just so much unknown. And I didn't want to start the procedure on a patient and then something go wrong and then be stuck in a position where I didn't know what to do. But I knew that if I didn't start somewhere, I would be stuck and I would feel like I was underachieving and doing a disservice to my patients by avoiding talking about the treatment altogether. And at that point, I had to make a decision. I was either going to sit on the sidelines or I was going to go surround myself with the resources and the support that I needed so that way I can navigate any challenges that came my way. And I knew I needed to go for it. So I did. I trusted my mentor and the treatment, and I put my best foot forward to help my patients and level up my career. And honestly, this was the best decision that I ever made in my career, because even though I had the fear of the unknown, I didn't know if it was going to work. It ended up turning out better than I expected. And then I've been able to actually help so many patients and other dentists along the way. And so this is where I want to talk about trial and error. So in dentistry, this is the nature of the profession, right? Whenever you're trying something new, you have to try and you have to know there's going to be some degree of error, but you just want to make sure that you are mitigating the error by having the education, mentorship, and support. See how that makes sense? Because if you don't actually try and you don't start, you're never going to do it. So how are you supposed to grow? And I totally understand. We are working on real patients, and I'm not saying to just go negligently treat people and like mess them up. I'm just saying, do yourself a favor and get the resources to surround yourself so you're insulated enough to know that you can actually take baby steps towards treating patients and being a better dentist overall. And I want you to remember, this fear of the unknown is not as scary as you think, especially when you have somebody by your side supporting you. Now, if you want to go deeper on this topic, you need to watch this video that I made for you. It is the next step that you need to take if you want to successfully start implementing aligners into your practice. I'll see you in there.